Just going to give people a minute to connect. Okay. Well, welcome everyone. I'm going to call the meeting to order. It is 6:38 p.m. on April 20th. And we'll start with the roll call. So Dr. Marla Gold.
Present.
Dr. Osama Bilal.
Present.
Dr. Hamid Ismail.
Present.
Dr. Ana Diaz-Rue.
Present.
Dr. Jennifer Ibrahim.
Present.
And Dr. Scott McNeil and Dr. Tyra Bryant-Stevens are absent this evening. So thank you everyone for being here. And thanks to the members of the public who've called in. So our agenda for tonight, first we'll take a vote to adopt the meeting minutes from our March 9th meeting. And then we'll have the receipt of public comment on an amendment to the 4th consolidated and restated supplemental regulation governing the control and prevention of COVID-19, revised safety measures and delegation of authority. So first, has the board had a chance to review the meeting minutes? And are there any questions about those? Okay. Is there a motion? Is there a motion to approve?
I move to approve.
Second?
This is Jen. I second.
All in favor?
Aye.
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 Any opposed? Great, thank you very much. Now I'm going to turn things over to Ben Hartung to explain the public comment process.
Thank you, Dr. Bedegal. Good evening, everyone. My name is Ben Hartung, and I'm a public policy advisor with the Division of Chronic Disease and Injury Prevention at the Health Department, and I'll be helping facilitate the public comment period this evening. The way it's going to proceed is that every member of the public who is present will have the opportunity to submit verbal testimony if they so choose. And if you do not want to submit verbal testimony, there's another way to proceed with commenting, and that will be to submit a written comment. And you can do that in the chat function of this Zoom hearing, or you could also send the comments directly to me. My email is Benjamin, BENJAMIN .HARTUNG Hartung @phila.gov. Any emails that I receive with written comments up until midnight tonight will be included in the public hearing report. So if you would like to, moving back to verbal comments, I will proceed to call on people, and if you would like to submit a comment, then the floor will be yours, and I'll ask you to unmute. We ask that if you are not, if you don't have the floor at this time, please to mute yourself and to stay muted until you're called upon, because we don't want the transcript, which we're creating for this hearing, to be garbled. So that leads me to my next point, which is that by participating in this hearing, you're agreeing that you're participating in a recorded hearing, and that this will be this is notice to you that it'll be posted publicly online on YouTube per city ordinance. This will also be published in a public hearing report following the hearing. So if you continue beyond this, just know that that's the disclaimer for your public participation. Now, before we get into the public comment period, I wanted to turn it back to Dr. Bedegal in case there was anything you wanted to say about the proposed amendment that we're hearing public comment on tonight.
Sure, and just to do a little bit of framing, what we're discussing is a narrowing of the masking requirement so that it would only apply to healthcare workers and healthcare institutions who are directly providing or during the direct provision of patient care. So, you know, it's narrowing it, it's not eliminating it entirely. I also want to say that I know people have a lot of strong feelings about this. We've certainly received quite a number of comments in both directions, people who feel very strongly that it's important to maintain masking and people who want to get rid of it entirely. So, you know, we are here to listen to any additional comments that members of the public have as the board deliberates. And I think that listening and hearing you all is a very important part of the process to us. I also want to say that there's nothing about the decision the Board of Health makes if we do either narrow or eliminate the masking requirement that stops any healthcare institution from being stricter. So a hospital, for example, could maintain masking regardless of whether the Board of Health, if the Board of Health narrows it, they could decide to keep it more broadly. And also, I want to make sure that everyone has the right to mask if they feel more comfortable. We don't want any situation in which somebody would be barred from masking. So with that, I think I'm going to turn things back over to Ben so that we can open things up and hear from you all.
Thank you, Dr. Bedigal. And before we start, I just ask that everybody attempt to keep their comments to a 4-minute time frame for now, because we want to make sure that everybody who joins the meeting has a chance to be heard. So I will just proceed now to call on people as they appear on my screen, and I apologize if I mispronounce anyone's name. But the first person I see is Yaron Fishman. If you would like to give a public comment, please unmute now.
Hi, can you hear me?
Yes, thank you. And I guess please, I should also say, please state your full name for the record so we know who's speaking to. Thank you very much.
Okay, my name is Yaron Fishman. Where do I begin? I'm a long COVID patient. I've been struggling with long COVID for 2.5 years. It's the most difficult thing I've ever had to go through. And when I was reinfected in July of 2022, my symptoms got worse. I was also diagnosed with POTS. And the fast heart rate from that exacerbated a heart anomaly, and I'm scheduled for surgery at Einstein in May. And I'm terrified of getting COVID again. I'm aware that many people are still dying from COVID every week in America. The last number I saw was about 100,000 people are dying. 100,000 people are catching COVID every week. And 1,300 people died last week. That's still a lot of people. So my question to all the decision makers is, how many more people are going to die or become chronically ill with long COVID by largely removing the mask mandate? I understand that the healthcare workers that are still working directly with patients are going to be wearing masks, but there's still a lot of people going into the hospital, and on top of that, those that are at high risk and immunocompromised are going to avoid going to the hospital or the doctor's office. And there could be deaths resulting from that. So I know there's a lot of pressure to do this because other places are doing it, but this is the city of brotherly love. Like, I don't know what words I can say to make you reconsider. Please reconsider, because at the end of the day, this is either, more people are going to die and more people are going to become chronically ill with long COVID if you loosen the mask wearing requirements. And I think that's the key question here. Is this going to protect people? Is this going to, save lives to tell people that they can come into the hospital not wearing masks? Is that really going to help people? And how many people are going to die by doing this? And how many people are going to become chronically ill with long COVID? So I respectfully ask all the decision makers to please consider this, and please consider doing something different, not being the same, as not just following the crowd on this, that you know, trying to pretend that everything's normal because 1,300 people dying last week, that's not normal. 1,300 people dying from COVID in the United States. So if the mask mandates are removed at the hospital that I'm going to, I don't know if I'm going to feel comfortable getting the surgery that I need. There's a lot of people in the same situation as me. I mean, at the very least, wait a few months, you know, see what happens at these hospitals that are loosening up the mask requirements. At the very least, you know, take a step back, please, and reconsider. I imagine I'm probably at around 4 minutes now. I don't know how long I've been talking. I could probably talk all day about this because I'm really passionate about this. I really don't want other people to die or get long COVID. And thank you again for thank you for allowing me to share my perspective.
Thank you very much for your comments, and I appreciate you sticking within the time frame. Thank you again.
Thank you.
The next person I have here is Runette Ferguson. Runette, if you're there and would like to give a verbal comment, you can unmute now.
Yes, I don't have any comments at this time. Thank you.
Thank you very much. The next person is Patricia Middaugh. Patricia, if you'd like to give a verbal comment, you can unmute now.
I have no comment at this time.
Thank you very much. The next person is Mary Ann Banbor. Mary Ann, if you would like to give a verbal comment, you may now.
Yes, Mr. Hartung, I had emailed you a response, but I would also like to echo Yaron Fishman's plea to please not narrow the mask mandates. Even though I understand healthcare workers dealing with patients will be masked, still, those of us who have to go to hospitals, it's not like a concert, it's not like a restaurant. We have to be there. And healthcare workers aren't the only problem when one is in a waiting room for hours in the emergency room or in the surgical waiting room, waiting with other people. It's comforting that other patients are masked as well. And it could be life-saving to have healthcare institutions continue masking. I urge you to keep the masks in place and not loosen the, and I'm afraid I think it's somewhat disingenuous to think that the hospitals themselves will choose to mask and not say, well, the Philadelphia Board of Health says it's okay to loosen the mask mandate. But thank you for asking our opinions. I'm very grateful. Thank you.
Thank you, Ms. Banbor. And I did receive your email, and it'll be included as a written comment on a report. I appreciate your comment. The next person I have is Mary Beth Taylor.
I don't have any comment at this time. Thank you.
Thank you very much. Is there anyone else that has joined that I'm not seeing on my screen that would like to submit a comment at this time? I'm hearing and seeing no extra people in the waiting room at this time, board members. So if we'd like to wait a couple minutes to see if anybody else joins, we can do that. Or if someone would like to respond, the time is yours, I
Yeah.
guess, Dr. Bedegal.
Yeah, I just wanted to open the floor in case any of the board members, I know, we'll want to make sure that we have time to review any additional written comments that come in between now and midnight tonight, and to take another look at the written comments that have already come in. But are there any board members who would like to comment on this or discuss at this time? it being very quiet. I want to thank everybody. I think this is an incredibly difficult question for all the reasons that have been brought up here. We've also heard some comments from people working in hospitals about their perspective, which is a little bit different, but I think as the board weighs this, I think please know that we all take your point of view and your concerns very seriously. In terms of next steps, Ben, do you want to just walk through for the folks here what will happen next?
Yes, so everybody's comments that were submitted today at this hearing, as well as the written comments we received by email, will be published in a hearing report, and that will include responses from the board members. And this report will also include the final version of the amendment to the regulations that we're discussing today. And that report and the final version of the amendment will be adopted at another public hearing. So there'll be public notice of that hearing, and the board will at that time at their if they would like to explain their decision, but they will be voting on the final version of the regulation at the subsequent meeting, which should be happening soon, but I don't think we have a date for that yet.
Perfect. All right. Well, I want to thank everyone very much for being here tonight. Board members, I'll be in touch about scheduling, and of course, we'll be in touch with a draft report for your review. Thank you all very much. Be safe. Good night. Oh, I should say I'm adjourning the meeting at 6:54 p.m. Did I miss a comment from somebody though? Okay, we're adjourning at, I'm sorry, 6:55 p.m. Thank you all very much.
Thank you.
Thank you.